Hello and good evening, and welcome to tonight's webinar, Innovations in Composite Technology, Versatile, Simplistic, and Cost-Effective. My name is Sam Hallibo, and I'm coming to you from San Diego, California. And for the next hour or so, I hope to be able to give you some pearls on techniques and materials that you can go back and start using in your offices right away. I want to thank you all for joining me tonight. I also want to thank Tokiyama for being the sponsor of this evening's webinar. A little bit about me. I've been in private practice since 1997. I'm also a clinical research associate. I've been a CRA evaluator since 1999. And I practice about 10 minutes south of downtown San Diego, for those of you that know San Diego. I'm a wet-fingered dentist, like most of you, working 4 days a week. I do a lot of bread and butter dentistry. I only discuss products that I use in my office after having researched them. What I'm going to show you tonight is the way that we do things in my office. Now, there are many ways of doing things, but these are the materials and methods that we find very effective and that work very well in our office. My concept is that I like to find and use materials that will either improve our efficiency, the quality of our work, and or our bottom line. So for tonight, you'll be able to post questions, and feel free to do so. At the end of the webinar, the last 10 minutes, we'll be going over questions. And anything that we don't get to tonight, my email is right there. You are welcome to go ahead and email me. I typically get back to you within a day or two. I also put up my website and the Catapult Elite website, where I list some of the articles and some of the studies that I'll be talking about tonight. Feel free to email me anytime about anything that we're going to talk about tonight. So let's discuss what we're going to talk about tonight. I'm going to do a little overview of adhesion. We're going to talk about where the adhesives have been, where they're going to, what type of materials they have, how they're bonding, how they bond to dentin. We'll also just do a summary of composites. We're going to talk about where they've been, discuss the different types of composites and where composites are moving to. And we're also going to look for what dentists are typically looking for in composite. I'm getting a note from Trung, 1 second. Okay, that should sound a little better to you. All right. What dentists are looking for in composites. And then we'll do some placement technique materials. We're going to talk about how we do our composites, and I'll show you a number of different ways which can hopefully help you out in your system and what you're doing in your offices. I'm going to talk about shade matching and hopefully try and simplify it a little bit for you. And the composite that we're going to talk about tonight really has some great features which I'm hoping you'll be able to utilize as we move on. We're going to talk about finishing polishing as well. And I'll show you some of the things we use in our office and some things that are pretty successful. We'll also spend a few minutes on avoiding failures. This is a big topic in that, we want to try and have these great-looking restorations that are going to last a long time. So I'm going to try and show you a few different things to help avoid these failures. And then we'll show some case studies there at the end. So let's talk a little bit about adhesion history. Basically, Bonacor in 1956 was able to bond to teeth using methacrylate and a little bit of acid. Now, the first generation of composites didn't come into play until the 1970s, but they were very weak at the time. They're, basically as weak as that picture up on the right-hand side where we're showing some tape there holding up a street crack. And as they started to improve a little bit, the second generations, which happened in the mid-80s, that's when we first started getting into smear layer, trying to remove the smear layer to bond. HEMA and the BIS-GMA came into use, although our bond strength didn't get much better. And I basically showed the bond strength to dentin here, because most of these generations pretty much had really good bond strength to enamel. It's the dentin that we've had the problems with. And that's the part that a lot of these companies have been trying to work on and trying to improve. The third generation was in the late 80s, and that had 2-component primary adhesives were introduced and acid etched to remove the smear layer. Now, the bond strength started to go up. They almost doubled since the first 2 generations there. And we started having a little more conservative cavity preps now because we were starting to get a little better bond strength to dentin. The fourth generations is really with the transformation of dentistry, and that was in the early 90s. That's when dentists really started beginning to switch from amalgams and started doing posterior composites. There was a good amount of decreased post-op sensitivity with these materials. The bond strength to dentin almost doubled. Basically what was happening is the etch was dissolving a layer of the mineralized enamel, and the enamel became rough, and the bonding agent basically flows into those holes, and it's cured into place. That upper right picture is probably a picture most of you have seen. It's an SEM of the enamel after it's been etched. In dentin, the etch removes the smear layer and some of the organic dentin, and it opens the dentinal tubules and forms what's the hybrid layer. Now, this hybrid layer is pretty much the most important factor to get a good stable bonding to teeth. So the fifth generation in the mid-1990s came out, and that was a single component where we had primer and adhesive together. This was pretty easy to use. It was pretty predictable. Again, bond strengths were slightly improving a little bit. Some of the different materials that were coming out at the time were Excite-F, prime and bond, single bond, etc. And then we had the sixth generation, which came out in the mid-90s to the early 2000s. And that's when there was no etching, basically. It was a two-bottle system. There was very little sensitivity. We didn't get too much of an improvement in bond strength, but the improvement in sensitivity was what we saw with the sixth generation here. And Clearfill SC was kind of the big name in that section there. The seventh generation is a one-bottle system that uses etch, prime, and bond. Basically, these are real easy to use, and they save time. There's little to no post-op sensitivity when you use these. You demineralize the smear layer, and the smear layer gets incorporated into the hybrid layer. Now, the hybrid layer is a lot thicker than the fourth and fifth generation one, which a lot of people in the studies think this is the main reason why there's such little post-op sensitivity with these seventh generations. Their bond strength is pretty good, still 18 to 25, and some example of materials in that are Optibond, Clearfill S3, and Bondforce, which we're going to talk about tonight. Let's talk a little bit about composite resins. Direct composite resins really developed in the 60s. They kind of developed hand in hand with adhesives. They were mainly used in the anterior up until about the 1990s, when we started kind of substituting them for amalgams, and the whole concept of minimally invasive dentistry came through. Composites are usually comprised of two different materials. In most cases, it's an inorganic or organic filler that's embedded in an organic matrix. You can think of it as silica or glass and a plastic material mixed together. Now, first there was the synthesis of bis-GMA monomer, and the first composites were usually chemically cured, and they were two-component materials. The earlier composites were the macrofills, basically, and they were the larger particles materials. These had little to no polymerization shrinkage, but they didn't wear very well. And one of the things that we'll talk about later is how when you have larger particles and you chip or you wear some of that, you'll wind up having a large divot within your composite that's pretty noticeable, and you'll see it as a good large wear spot. Microfills came along next, and they started wearing better, but these had started having shrinkage, and these basically came around the time when light curing was starting to come around, and the visible blue light came through, and polymerization shrinkage issues started. Now, there's been a number of different composites since then. Basically, hybrids started coming along where they started mixing the microfills and the macro fill materials. We also had flowables, microhybrids, nanofills, submicron. Basically, composites are based on the particle size that they come in. So let's talk about some advantages to composite resins. Well, they're obviously more conservative. You know, we're away from the days of GV Black. We're having the big preps and things to hold our restorations in. Basically, you're removing the decay and bonding your material in. And that's one of the other advantages, is you're able to bond to tooth structure. They are more aesthetic and they're desired by patients. I haven't done an amalgam in over 16 years. And I think all my patients come in here basically assuming that we're not going to place any amalgam in their teeth and really no metals at all here in my office. They also set on command. Anytime you carve out your amalgam, your composite, and you can put the light to it, and it's set and ready to go. Composites can be repaired, which is a great feature. If you have a little chip, you can always go in there and repair a chip. Sometimes even some of the micro leakage that can be happening, you can also go in there and repair. Now, one of the things we'll discuss a little bit about, which most people don't think about in terms of composites, is longevity. Let me show you a little study here on longevity. This was in Dental Materials in 2007. They took over 900 amalgams and over 1,900 composites, and they were placed in general dental offices in a period of about 5 years. And basically, these people were tracked moving forward on a semi-annual basis to check on these restorations, and then they listed the 5-year and the 10-year survival rates. And you can see the composites actually did better in this study than amalgams. Now, with everything that has advantages, obviously there's going to be some disadvantages. And disadvantages to composite resins, there's a few, and we're going to discuss these in more detail as we move forward. But technique sensitivity is one of the ones people always talk about. Obviously, there's a lot of different materials and different ways of doing composites. And so there are different parts to the techniques, and there can be problems in trying to follow the instructions and trying to do what each manufacturer suggests. I'm going to try and simplify that for you a little bit tonight with the materials we're going to use. Also, a lot of people complain that composites are time-consuming and labor-intensive. They can be time-consuming, especially if you think about having, a few quadrants where you have to do a few quadrants in a row during the day. And labor-intensive if you're doing them, the old-fashioned way in each step and every material. They are going to take a little bit longer, and we're going to try and speed that up a little bit for you tonight as we go through. Now, wear resistance is another complaint that we get in terms of composites. And I'm going to show you a study or two that are shown with some of the materials that we're going to have that hopefully help alleviate some of those concerns. Polymerization shrinkage is obviously the big one. Composites shrink, and we're going to go through a few different ways of helping reduce some of that shrinkage. Now, what causes composites to fail? In this study that they did, they looked at a number of things, and they came up with 4 big ones that they found. Basically, post-op sensitivity. If you're using a 7th generation adhesive, you really should be getting little to no post-op sensitivity. And if you are getting post-op sensitivity, it is considered a failure. Marginal discoloration. You really shouldn't be having marginal discoloration, because when you do, it means that there's a gap formation and that bacteria is entering. Now, you got to remember, bacteria is 1 to 3 microns, so it can pretty much penetrate almost any tiny little crevice that's being left behind. Secondary caries, in this study they had found it for a couple of different ways. Secondary caries can come from patients' bad hygiene, obviously, too. But if you have class 2 composites where the box is quite deep, if you're not getting a very good seal there, that can also, be a cause for secondary caries. And obviously the big one was the polymerization shrinkage that causes the loss of the bonding. So over 1,200 dentists were surveyed, and they were asked how many Class 1 and Class 2 composite restorations did they place in a week. The majority answer that came back was an average between 15 and 30 restorations per week. These dentists were also asked what was the depth that these restorations were, like how deep were they. And 75% of these people that were polled said that they were 3 to 4 millimeters deep. They were finally asked what they really wanted out of their composite restorations, and I went ahead and listed the top 12 things that dentists want out of their composite restorations. They want a rapid procedure, marginal integrity, obviously. They want a good depth of cure. They want to make sure the composite's curing well. They obviously want less sensitivity. Good solid mechanical properties in their materials. They like to place it in a single increment. They want to have a good high bond strength, And obviously they want them to be aesthetic, as our patients do. I think all our patients want is for their restorations to be aesthetic and to last a long time. They want a simplified shade system, because the shade systems that are out there can be pretty daunting. There's quite a few systems and they can be very large, and we'll talk about that a little bit later here. They want their composites to not stain. They want them to be pretty radio opaque so they can see them very well in x-rays, and they want to have less technique sensitivity. So there is a number of adhesives in the market today, and I could probably list 30 more up here and put them up here, but I just listed a few just to show you. If you're using any of these materials or any material you use in general, please make sure you're reading the manufacturer's instructions. Just that one tip alone, if you're using the materials and following the instructions, that can help you out considerably and decrease the amount of failures that could happen with composites. The adhesive we're going to be talking about tonight is Bond Force by Tokuyama. This is an excellent material, and there's some great studies and things that I'm going to show you about it tonight, and I've been using it for a while as well. So this is a single component self-etching adhesive. One of my favorite parts of it is that it requires one application. So you can place this material on and basically scrub the cavity for about 20 seconds. It has great bond strength, can be used on cut or uncut enamel, fractured porcelain, composite repairs. There's no etching and no rinsing, which, when we're trying to speed up the process and make composites a little more fun and a little faster, anything we can reduce is great. It does have fluoride releasing. It's got a real thin film thickness. It's only 8 microns. And they have this great pen dispenser which gives you these uniform drops with less waste, and I'll show you a study later that really shows you what the cost is of these adhesives and per drop. That's going to be pretty interesting to see. The composites, and again, I could probably list another 30 or 40 up here in terms of these. There's many good ones on the market. The one we're going to be talking about tonight is Tokuyama's Estelite Sigma Quick, which is an excellent material with some great chameleon effect that's going to really help in shading process when we get to that section. This is a universal restorative. It has an extended working time. It's about 90 seconds in ambient light, which is one of the great features, because if you're working on a quadrant, as most of you probably know, if you're trying to do all the teeth at once, some of those composites can start to set on you. And having a composite that can go up to 90 seconds in ambient light is a great thing. It also has the reason it's called quick is because it has a reduced curing time. It's a 10-second curing time, which is about a third of the standards in the market today. Another thing that helps us reduce the time of doing composites. It's got great polishability, it has great gloss. I'll be showing you some studies on the wear resistance also. Now this can be used on anteriors, posteriors, composite veneers, enclosed diastemas, and composite and porcelain repairs. So let's discuss polymerization shrinkage. Basically, this is the curing contraction that happens when you cure composites. What happens is that during the polymerization reaction, the composite changes from viscous to viscous elastic to elastic. And when the composite develops an elastic modulus, basically the contraction becomes shrinkage stress. So now the stress causes the bond strength to the tooth to the restoration interface to kind of break down there, and then gaps form and you get the loss of adhesion. When the loss of adhesion occurs, you're getting fluid movement, which causes sensitivity to the patient. The thing you're going to learn is that adhesive shrinks, and so do composites, which is one of the big failures when we have composite restorations. Now, some of the ways you'll see this is you can see it in white lines, you can see it in gaps, and sometimes even in cusp fractures. So I wanted to show you a little bit in terms of a polymerization shrinkage study and some of the volume shrinkage that you can see some of the top composites do here. Now, a typical composite is going to be having about 1 to 5% volumetric shrinkage that occurs. And as you can see, there's some of the ratings on some of the composites are there. Now, one of the ways we can reduce the sensitivity for polymerization shrinkage and other factors is by using materials like bond force. This is a self-etching adhesive that releases fluoride. This modifies the dentin, making a second layer there of caries prevention and down in the hybrid layer. This is called a superdentin, and it's an acid-base resistant area that's down under the hybrid layer. Let's talk about technique sensitivity a little bit. One of the first things that comes into mind is isolation right before we start. And if you don't have good isolation when you're doing these restorations, any bonding restoration essentially, if you don't have good isolation, your restoration is probably going to fail faster than it should. We'll go into isolation and kind of discuss some different things in it. Now, there are a lot of differences in technique sensitivity, you know, whether or not to etch, how long do you etch for, do you dry but don't desiccate to the tooth. Also, curing times and distance from composite. There are different studies that are telling us different things to do here with composites and trying to minimize some of the sensitivity with these techniques. Technique we're going to talk about, we're going to start with isolation, and on the right there I show you some of the things we use. Now the standard is going to be the rubber dam, and I know a lot of people complain to me at lectures about how long it takes to do the rubber dam and you know how it's slowing down the procedure. Well, I will tell you most studies show that if you do use a rubber dam, that the procedures are actually going to be much faster. One of the things we do in my office is that we have the dental assistant place it. I'll typically go in and I'll numb the patient, then I will go and do a hygiene check, and my assistant will go in there and she'll put the rubber dam on, get the patient all ready to go. By the time I come back, we're ready to start prepping. Most states, I think, allow that. You just have to check to make sure that your auxiliary is able to do that in your state. If you can't use a rubber dam, there are other things you can use. An isolite system is definitely one of the things that we can use. There's also what's called an isolation system, which is just like an isolite, but it doesn't have the light built into it. Now I have a light above my loop, so I tend to use that. So I like the isolation system a little better, and it tends to be a lot cheaper per each patient used than the isolite system. Also, you can use cotton, and you can definitely be using cord in order to isolate the area and some of the fluids away from the teeth. I don't really use cord as much anymore because I'm using a laser a lot more now. I'll typically go in there and I'll trough an area down in the box if I need to. And also, I don't know if you guys ever had this, but when you place your matrix sometimes and you're ready to start your restoration, and you look down in the box and you see a little bit of tissue sticking in underneath your matrix. Well, with a laser, you can just go in there and remove that little tissue, push your matrix down and push your wedge in and go and get started right away, rather than trying to go in, put the cord and do all these things and try and stop bleeding and everything else that you're going to have. So let's talk about the technique a little bit. This is a pretty rapid procedure. Once you isolate the teeth, you're going to apply bond force and you're going to rub it in for 20 seconds. After that, you're going to air dry it for about 10 seconds. And then you light cure it for 10 seconds. So total there is 40 seconds to place the adhesive. So I think that's a pretty quick way of doing it, a pretty good way of doing it, which is going to speed up your procedure and allow you for a great result as well. Then you place your composite, and the S-Delete Sigma Quick cures in 10 seconds also for every 2 millimeters there. So that's a fast cure as well, essentially. The reason this composite cures so fast is what's called the RAP technology that Tokiyama has. This is a radical amplified photopolymerization initiator. This initiator basically balances out the high polymerization activity that's needed to cure the composite with a short exposure time that you need. And also allows it to have stability in ambient light, which is that 90 seconds that lets you work in there. Okay, so a lot of people complain about time-consuming and labor-intensive composites. Well, composites take too long. And composites can certainly take a good amount of time, and one of the ways we're trying to do with this procedure is trying to speed them up. And like I said, bond force is applied in less than 1 minute. S-Delete Sigma Quick cures in 10 seconds for every 2 millimeters. Your longest part of the prep is going to be the prep and the rubber dam, essentially. So I think that'll speed up some of your process there. Also, lots of work for little pay, and I can certainly sympathize with that. Being in California, where we have Delta Dental is trying to cut 10% off essentially our premier Delta fees across the board, and it sounds like this may go through here pretty quick, and it doesn't look like any dental societies can do anything about it. So that means we would basically wind up getting less pay for some of these composites. So one of the things we do want to do, if we're getting less pay for these, is definitely be able to do them a little speedier and a little more cost effectively. Conventional layering, that's been found to be essentially the best way to combat some of these polymerization shrinkages, and we'll talk about C-factor and things a little bit later. Another complaint also tends to be that contacts can be tricky. One of the worst feelings that you can have is when you finish a composite, a Class 2 composite, and then you go to put your floss through, and basically it slides right through without any contact. Well, you just spent that whole time working, and you have a pretty lousy contact. So I'm going to show you a couple of things in terms of matrix systems that will hopefully help you out. There is a number of good matrix systems in the market. Anywhere, a lot of people have different systems, anywhere from Toffelmeyer to clear matrices, to these different systems that I have listed here. The one that I typically use is the Triodent V3 matrix. This is an excellent matrix system, and I've been using it for a long time and get excellent results with it. The reason I like it is because the rings are made of this nickel titanium material, which is really elastic and tends to return to its original shape very easily. I've used other systems in the past where they work great in the beginning, but after you use them for a while, you start to see the ring not really jump back into its old shape, and it doesn't make for such a great contact, and then your contact starts getting looser and looser. These are fully autoclavable. And the other thing about the matrices here, all the matrices as well as the wedges have these little holes in them, and they give you these tweezers to hold them so that you can place them in the exact locations without really fumbling around with them and having them drop everywhere. It's also nice that they have little holes on the sides of them, so when you're done with your restoration, you can put the tweezer in and basically pull that matrix out without any problem. One of the other things that they have is these wedge guards, which when I first got these, I really wasn't a big fan, and I thought this might be just an extra step that's just going to take more time and slow down the procedure. But when I actually went to use them, and then I looked at them, and I actually put a picture here on the bottom right to show you, what happens is when you drop a box in a Class 2, a lot of times you're, even being super careful, you'll still nick the neighboring tooth. What I used to do in the old days, I always took a diamond strip, and I went in there and smoothed out the neighboring tooth, just to smooth the contact out if I nicked it at all. With this in place, basically you can see how much of the burr it takes and can handle a lot of burr hitting there. So once you hit that, once you're done with it, you can remove the metal part, slide your wedge out slightly, and then put the matrix in there and put your wedge back in. So it really takes a couple of seconds just to do, and it allows your neighboring tooth to go untouched there, unharmed. A little bit on wear resistance. Wear is the erosion of material from a solid surface by the action of another surface. This is kind of a big. This is big in composite dentistry and in dentistry in general. One of the things that I'm always looking at with patient's dentition before treatment planning is to kind of determine what kind of restorations I'm going to use. Because sometimes if the restoration is really large enough, you may be better off with an indirect restoration. And I always like to think about how long is this restoration going to last in the patient's mouth. Now, sometimes we're handcuffed with financial issues of the patients and things like that, but typically when I look at the mouth, kind of idealize what your restoration is going to look like and look at the wear patterns of the patient's mouth before you plan on your restorations. That's really going to help your wear as you move along. Now, having said that, we're going to show you some wear studies that were done, and these were done at the Tokyo Medical and Dental University. So what they did is they took these teeth and placed these different composites on them, and they put them opposing natural tooth structure, opposing another set of teeth. And basically they went over and they had them wear across from each other, back and forth for about 60,000 cycles. And then they measured the volume, the volume decrease in the composite, and also the abrasion depth on the opposing teeth. And you can see S3 Sigma Quick did really well in this test. And part of the reason is that the filler particles that are used in S3 Quick, these are very fine, uniform diameter. The picture at the bottom picture, you'll be able to see these. They're fine, uniform in diameter. They're considered super nano, which is it's smaller than a micron and it's bigger than a nanometer. Now, these fillers are uniform, whereas if you look at the other composites that you have there from other manufacturers, you're going to get some irregularity because most of these are hybrids. So what happens in a wear study, especially in wear in the mouth, as you get chipping, when you have larger particles, as you do with some of these other composites, you're going to have larger spots of ditching and larger spots of wear that are going to show more. And that's evident in the study that's being shown there. A little bit on micro leakage. Basically, micro leakage is what can cause sensitivity. It can cause some secondary caries, corrosion of dental materials. I put some different pictures of it there. It's basically a discoloration of teeth. And like I said before, bacteria is 1 to 3 microns, so it can really penetrate anything that's not sealed well. A couple of studies on staining and marginal leakage here. The left is a staining study. Composites in the mouth are basically going to break down over time, and that's typically due to food and drinks that are put in the mouth. Now, in this study, what they did is they took these various composites, different composite materials, and they cured them, and they placed them in coffee at about 80 degrees Celsius, and they basically let them soak for about 24 hours. Then they measured how much of a shade change took place. And so the left side there shows color stability of the material before and after that particular test. On the right side is a microleakage study that was done on human molars. And basically what they did is after placing the molars in 37 degrees of water for 24 hours, they then let them collide about 100 times a minute for about 24 hours, basically having them hit each other. And then they put them in some heat shock, going from 4 degrees to 60 degrees Celsius, and thermocycled them 500 times. Then they soaked them in this 0.1% concentration of fudge-sign solvent, and they let them stand at 37 degrees for 24 hours. And the table there shows what kind of pigment penetration happened with these different adhesives. So the two adhesives that did the best were bond force and SE bond, as the others all had some form of micro leakage. A little bit, some other clinical research just shows a little bit on bond strength and sensitivity. This particular study was done in North Carolina, and it shows the bond strength, the microtensile strength. The tensile strength is basically the maximum stress a material can handle while it's being stretched or pulled in different directions. So in this particular study, what they did is they looked at different adhesives, and they tested them after 24 hours and then again 1 year later to see how they did. And they did it on 7 different materials that are fairly popular brands. And bond force did pretty well in this study. So let's talk about some things that are going to make our that are simplistic and can be cost effective. Now, one of the things I always talk about is shade matching. So let's review that a little bit. So we have the hue, which is the name of the color pigment essentially. This is the red, blue, yellow. If you can think of the Vita shade guide, the classic Vita shade guide, this is the A, B, C, D. Chroma is the perceived intensity of a specific color. So this would be, if you had your A shade guides, this would be A1, A2, A3, A4. And then value is the brightness or lightness, basically. It's the black to white and the gray in between. Now, value is typically the most important one, and 80 to 90% of the time, if you get the value right on a shade match, you're pretty much going to nail the shade. Some different parts of the teeth have different shade colors to them. The gingival third tends to have the most color. It also has low value and high chroma. The middle third there is the brightest with the highest value. That's typically the one you're taking a shade on most of the time with a Vita shade guide. The incisal third has the lowest value and also has high translucency. Now, most color in composites comes from the dentin. So typically when you get the dentin color right, you're going to pretty much get the composite shade right. And the most popular dentin shades are A2, A1, and B1. Now, one of the great things about this Estelite Sigma Quick is that some of these shades can actually cover, like each shade can cover a few shades in the spectrum. So an A1 can cover from a B1 to a C1, which is what I really like about it, in that I don't have to have like these big, huge kits that come with some of these composites where you're using maybe 5 or 6 of these, and then about 20 of them are left behind that wind up expiring, or you use them for buildups and other things. You can actually have basically 4 or 5 shades here that'll cover the entire spectrum of everything you need. Now, they also have a bleach shade, which I like to use on some of my patients because we have a lot of patients that bleach their teeth. But you can see that just a few shades will allow you to cover quite a few shades in the spectrum. That way you don't have to have such a big load in the back room. Also, the Dental Advisor had a case study in March of this year where they showed how one shade, shade A3, of Estelite Sigma Quick basically replaced 8 other different shades that they used. So they showed 8 different restorations, and each of those restorations was a different shade than A3, but they used the A3 composite. And they showed before and after photos, and they all looked fantastic. The reason that happens is Estelite Sigma Quick has this amazing chameleon effect, which lets you, basically cover a whole bunch of shades in the Vita shade spectrum. Now, this is one of the studies that I was talking about earlier, and this shows the price per drop of your refill materials and adhesives. This is pretty interesting because when I've showed similar slides to this before, and I always get dentists who ask me to email them these so they can show them to their assistants, so the assistants can see how much things cost, because each drop does have its cost. You can see on the list how much your adhesives are costing, basically. And in this world of cost-effective and the price dropping by the insurances, it's kind of important to watch some of these numbers, because bottom lines are important as well as we go through and try and maintain our offices. A little bit on polishers. I tend to use a few different kind of polishers. Shofu, I use a couple of different polishers. These Dura white polishers are used in a high-speed handpiece. You have to use them with a very low speed and lots of water. They also have their Compomaster finishing polishing kit. It's a really good kit to use. SS White has these Jazz polishers, which is a one-step universal polishing system. Whenever I can, I try to use a 1-step or maybe 2 steps at most. This kind of minimizes time and lets me go through the process a little bit quicker. Also, Diamante is a Voco brand, which is also a 1-step universal polishing system. Now, let's talk about avoiding failures a little bit in composites. So one of the big things is a C factor, which is this configuration factor. This is the ratio of bonded to unbonded surfaces. I showed a couple of pictures in the middle there. One of them is a class 1 and the other is a class 2. So what happens in a class 1 composite is that it's going to have probably the most stress. And the reason is because it has the highest C factor number, which it has a 5. The way it gets a 5 is that there's 5 bondable walls to 1 unbondable wall. The 5 bondable walls you can see within the box, the 5th one being the pulpal floor there. And now this 5-to-1 ratio creates stress, and shrinkage occurs basically due to the polymerization or the curing light. Now, most of the time when you're going to have sensitivity, a lot of the time it's going to be in these class 1 composites. These are the ones that tend to have the highest C factor. As you go into class 2, class 3, class 4, your C factor goes down, partly because you're increasing the number of unbonded surfaces. And so your C factor number goes down, the amount of sensitivity goes down, and the amount of stress goes down in the restoration. Now, there's some ways we can combat this C factor material, and the best way that's been shown is through this incremental layering, the oblique increments. I'm showing a picture there on the bottom right. Now, that one's a little bit overkill, but you kind of get the idea by placing layering increments in oblique fashion, this tends to minimize the C-factor stress. And this can also be done in a class 1. A lot of my class 1s, I'll tend to place them, even when they're shallow, I'll still tend to place them in 2 increments to allow for this incremental layering to kind of minimize the C-factor. Now, polymerization shrinkage is basically the problem also, and one of the ways we can combat that is the altered light curing cycles. There's different ideas on this. The best way that's been shown is by doing a ramp technique, basically starting out at 230 milliwatts per centimeter squared. One of the newer studies is showing that if you do that first for 10 seconds, and then turn the light off for at least 10 seconds, and then go back in and bond again, or go back in and light cure again at 450 milliwatts per centimeter squared at the very end. That tends to give you the best way to combat this polymerization shrinkage. Also, incremental curing, a composite and layering technique helps with polymerization shrinkage. One of the other things that can help avoid failures is try and avoid very large restorations. Again, things that may need an indirect restoration, you might want to do them as that. And avoid deep gingival preparations. A lot of times when the prep starts going into the box and it starts getting below the gum tissue there, you can have a hard time trying to minimize the amount of fluid that's going to be going by your matrices and things like that and trying to close the box. So let's look at some clinical cases here. One of the first things I want to show you is this photo on the right, and that's one of the things we do quite often in my office. Actually, we do it every time, and that's taking articulating paper and having the patient bite down on it and grind side to side on it. And to be honest, I typically have my assistant do this so that I can go in and basically it's already done for me and I can just look at the tooth. The reason we do this is that we don't want to have the patient occluding on our margins of our restoration. They can occlude on the composite or on the tooth structure, but we don't want them occluding on the margins. Just that tip alone will help make your restorations last a lot longer, and it can help with marginal leakage as well as these gaps that can form in some of these composites. So just have your assistant do this quick little step even before you go in there. Sometimes what mine does is she does it before she puts the topical in there, and then by the time I come in to look, I'll basically look at it and get an idea of what it is before I numb them. So then we place our rubber dam, we place our wedge there, and you can kind of see what it does. It protects the neighboring tooth. We remove the amalgam, we place our box, we check and make sure there's no decay left. You can see the V3 ring really hugs the tooth really well there, and it's really tight. So once you take it out, I've never had one of these where I go to pull the matrix out and it comes right out. I always have to give it a good little tug to get it out of there, so I always know that I'm getting good contact with it. Then you see us placing our bond force there for 20 seconds and rubbing it in. You light cure it, then you start placing your composite incrementally. And I do have a couple of burrs that I sometimes use. Most of the time I tend to put my anatomy in before I actually light cure, but there are a couple of burrs that I do use. The one on the right is a Raptor burr. This is a burr that's actually most everybody carries it now, including Shofu, SS White, Brassler. Any of these have this little burr that has a little acorn on the end of it. And I also tend to use a fine diamond football, which most of the companies tend to use as well. And you want to use these quite a bit of water. Actually, just have it dry there so you can see it and see what it looks like. Your restoration is finished, it's placed, and it's done. So I'll show you a little before and after. So what did we do here? Basically, we did a pretty conservative restoration. We did it pretty quickly, and you're placing the adhesive in less than a minute. Your composite is curing 2 millimeters at a time and at 10 seconds each. So it's aesthetic. This is a single shade that we're using. Basically, all of these that I wind up doing here are single shade materials that have a great chameleon effect that blend very, very well. There's fluoride release, and there's that superdentin, so I know I'm helping fight secondary decay. They're non-staining, and you saw some of the studies that show that. High radio opacity. They have great contact, especially with this material with a V3 ring. And this is a restoration that's going to last a real long time. This is another case, and you can see again we're always taking our articulating paper and checking and seeing where the patient bites and where the contacts are. I'm going to show you something else in this particular case. We place our rubber dam, we clean out the decay and clean out the old amalgam. And we have our V3 ring there, and this is the dispensing of the bond force. The clicker, once you click it twice, and it gives you one perfect drop each time. Basically, you take that and you go into the tooth and you rub it for 20 seconds straight. A single application. And then you place your composite, you place your anatomy in there, and then you light cure, and you finish your restoration. Okay, so we're going to have a few minutes here. We're going to go into question and answer mode. So if you have any questions, please post them here as we go through. I'm going to go through these and kind of read a couple of these here. It says, what adhesive do you recommend if I only buy one? And this is from Brazil. Wow. You know, Bond Force is an excellent adhesive. This is an adhesive that you can do most anything with. And it's got great studies. It's, you know, the price is right. It's got great chemistry behind it, a great company. I highly recommend it. Give me a moment as I go through here. One of these says, any comments on OptiBond FL? Also a very good material, as I listed before. You know, these are all good materials that you have there. You know, when I look at them, I kind of look it over everything. And one of the titles was to kind of look in terms of conservative and conservative materials and good materials that you can use that don't cost very much, that have great chemistry behind them, have great studies behind them. But OptiBond obviously is a good material as well, so that's one you can use as well. This question is, what is better, repair or redo the restoration? It really depends on the restoration. There's different trains of thoughts on this. Sometimes basically you can go in thinking that you can repair, and the restoration starts to get bigger and bigger as you go down. If it does, sometimes it's a little more ideal to just remove the whole restoration and do it. But if you just have a little chip where you can go in there and you're pretty sure that there is no leakage going down further below your restoration, then it's not a bad idea to repair these. Okay, let's see here. Okay, let's see. Some of these are starting to repeat, so bear with me here. One of these says, what can you do for deep cavities? Can we put glass ionomer? Yeah, you certainly can. There's a number of different products you can use. Glass ionomer certainly is one. Viscose Theracal is one. There's a number of different products now in the market that are being used in deep cavity areas, where then you can start to place your restorations on top of them. Let's see. Bear with me here as I go through some of these. This one is asking, what are the primary causes for post-op sensitivity? We went through a couple of these here. So some of the causes are some of these polymerization shrinkages, and as I was saying before, you'll typically see it in a class 1 composite, which has a high C factor because there's so many walls and you're having contraction. Once you cure the composite, the enamel is the composite is sealing to the enamel very well, so it's adhering to that. So what happens is down in the bottom layer is where the dentin is where it starts to pull away, and as it does pull away, that's where you'll get some fluid movement in the dental tubules, and that's where you'll get some of your pain. So that can be one. Also, technique sensitivity is huge. If you don't have an isolated field, if you're having fluids all over the place, that can also cause major problems to your restorations and cause some of this post-op sensitivity. But I will tell you, using a 7th generation like Bond Force will really do away a lot of your sensitivity. I mean, I almost have it down to 0 in terms of sensitivity on my restorations. Let's see here. Let's see. When are inlays and onlays a good choice for restorations? You know, my train of thought is if you have a restoration where where your cavity is going to be more than 1/3 or 1/2 the isthmus of a tooth, I like to think of indirect restorations. Because what happens is you can control it a lot better. You don't have to worry about so much of the tooth structure being missing. And again, you have to look at the patient and see what their occlusion is like, how they wear, and sometimes that can make a big difference because, you know, depending on the size of the restoration you're going to have, and I typically give my patients an option when it's a pretty big size. I tell them, you know, ideally you should have an indirect restoration, and if they're really tight on money or something, sometimes we'll just do a composite for now and see how many years that'll hold up for them. And bear with me as I go through a couple of these more. What classifies a bonding agent as a 7th generation is this question. Basically, is when you have a one-bottle system. You're having the etch, primer, and adhesive all in one bottle. Like we said earlier in this one says, is Esteli Sigma Quick only used for posterior restorations? No, it's not. It's actually used for anteriors, and it's used very well in anteriors. The chameleon effect you have with it tends to work very well anterior and posterior. This composite can pretty much be used for anything any other composite can be used for. Shade matching in it tends to be great, so you can use it in the anterior and posterior sections. And one of the things that I like is that 1 or 2 shades can really give you a large number of shade coverage. Let's see here. We have some repeats here. That's lead okay. No light cure bonding. I'm not sure what that one means. Bear with me here as I'm going through them. There's a number of them and they're starting to repeat here, so. Do you know if the clamps are interchangeable between companies? I use the Paladent kit and the clamps begin to look bad. I'm not sure because I don't have the Paladent kit, but you can certainly try it. You know, sometimes if you, I have heard that actually where if you autoclave some of these clamps of other systems, they tend to start going bad a little bit. But I'm not sure if you can kind of cross-match them and if they fit on each other's wedges. The one thing about the Triodent system is I know that their clamp fits right on their wedges, the way their wedges are shaped in that particular way. Let's see here. Do you ever place a sealer after you place posterior composites, and do you really believe in it? Now, some studies show that it's great to place a sealer in composites, and there's other studies show that the sealer tends to wear out in about 6 months. I'm one where I haven't been placing a sealer. There are some good sealers out there, and I've heard about them, and I've seen some statistics, but I've also read others where basically the one thing I don't like is after you place the sealer, a lot of times, no matter how thin you get it, you still feel like your occlusion's a little high, and you have to go in there and kind of adjust a little bit on it. And I always feel like I'm removing part of the sealer, so okay, did I just waste time placing the sealer on the tooth? I do have it, I've used it before, but that's been one of the problems I've encountered with it. Let's see. Okay, I'm starting to look through here. Adhesives do you recommend? There's a couple more questions coming in here at the end. Let me just check those. The 10-second cure is with a halogen light, not an LED. Yes, that is correct. 400, basically a 400 milliwatts type light. What do you think about heavy flowables? Now, I have used flowables in the past, and I do still use them at times. There are times when I'll just place a very tiny layer, basically a half to a millimeter of a flowable on a deeper restoration at times, or sometimes in the box of a class 2 restorations. Okay, I have a couple more coming in here. Can I have the picture of the price of one drop? I thought that would come up. It usually does. Yes, please email me. You can see my email address there up on top. Email me if you would like that. I will email that to you within a day or two, no problem. Okay, let's check these last couple here. This one says, thank you for your presentation. Thank you for being on the presentation. It says, is there any chance of this coming up again? Yeah, this webinar will be on demand in about a week or so. So you'll be able to watch it again if you'd like. And the rest are thank yous. Well, I want to thank you guys for joining me tonight. And I also want to thank Tokiyama for sponsoring tonight's webinar. I hope you all have a great weekend and enjoy the rest of your summer. Take care and good night.